Good morning, everybody. Dear audience, please allow me to present my PhD thesis with the title Optimizing Radiotherapy, Pediatric Brain Tumor Oncotherapy. My name is Renáta Kiss-Miki. I'm a first-year PhD student at Semmelweis University. My supervisor is Miklós Garami, and my scientific methodology supervisor is Vanda Mate. My mission is to give a better life with less side effects for pediatric brain tumor survivors. And for this, I'm willing to help the pediatric brain cancer patients and the researchers to improve the quality of life of them. For this, I'm running two projects, in both of them investigating different types of radiotherapies and comparing the efficacy and side effect of them. In my first project, by performing a systematic review and meta-analysis, I am investigating the efficacy and side effect profile of radiotherapeutic modalities used in the treatment of pediatric brain tumors. A few words about the background. Childhood brain cancers are more than 20% of pediatric malignancies, and more than 80% require irradiation to provide optimal survival. As we know, the radiotherapy have a lot of irreversible, life-threatening side effects like neurological problems, endocrine deficits, and neurocognitive decline. So our aim is to find the least harmful yet effective radiotherapy modality in pediatric brain tumors. As we know, there are two major types of radiotherapy, the photon one and the proton one. The photon radiotherapy modality is the oldest one, but it made a huge development in the last decades. And the newest in this generation is the CyberKnife, but the most used nowadays is the intensity modulated radiotherapy. On the other hand, the proton radiotherapy is a new class of radiotherapies with a lot of promising outcomes, but it still requires some research to provide the efficacy and side effect profile of it. So, considering all this, our clinical question is which irradiation method is the least harmful, still effective for children treated with brain tumors? We are investigating children with brain tumors, comparing the two major types of irradiation, the photon one and the proton one, and measuring the survival and frequency and severity of side effects. Our hypothesis is that the CyberKnife method, one of the photon radiotherapy modalities, improves the survival and decreases the number of adverse effects compared to the other types. Our clinical and research implication is to define the best irradiation technique for pediatric neuro-oncology patients. We conducted a systematic search in 4 databases at the end of last month, and we gathered around 4,000 hits. And our final search key has 3 main domains: a pediatric domain, a brain cancer domain, and a radiotherapy domain with 2 arms, one for proton therapy and one for photon therapy. So I mentioned before we had around 4,800 hits, and after duplicate removal and title abstract selection, we gathered 68 articles, and after finishing the full text selection, we have 49 articles that met the eligibility criteria. As continuing my first project, in my second project, by performing a registry analysis, I'm comparing the doses and side effects of radiotherapy in pediatric CNS tumors. Why is important? As I mentioned before, it was a huge development and advance in radiotherapeutic modalities resulted in promising outcomes in tumor management. And let me remind just a few types of radiotherapy modalities that are currently used. For example, the intensity modulated radiotherapy, volumetric modulated arch therapy, and stereotactic radiosurgery. All of these are photon radiotherapy modalities. So our aim is to investigate the side effects of different irradiation doses among children with CNS tumors. In this project, our clinical question is, what is the minimal yet effective dose that reduces the neurological side effects after treatment? We are enrolling patients, children with brain tumors, comparing radiotherapy dosages, and measuring the neurological side effects. Our hypothesis is that lower radiation doses can minimize neurological side effects with retained efficacy, and we are doing all this to provide data for protocol establishment. There is an already existing registry, the Hungarian National Childhood Cancer Registry, that was established 35 years before, and from 10 years it has a network-developed database also. Patients from all over the country are enrolled, and every year a follow-up document is required from every patient. We can find data about the histological type, grade, localization of the tumor, but also personal data, and the treatment methods are also find it there. And I would like to show you here a guideline that was published this year in February by a French working group. And in this paper, we can find all the currently available irradiation techniques, but there is a lack of dosage data and describes just a few types of tumor. So that is why it's important our work. To summarizing, I'm planning to finish my first project next year on May, and my second project at the end of next year. I would like to end my presentation with a quote from Nido Kubin, who is a Lebanese-American businessman and a motivational speaker, and he said, when a goal matters enough to a person, that person will find a way to accomplish what at first seemed impossible. And thank you for your kindly attention.
Thank you. It was a very good presentation. My first question for you would be, what's the difference between this proton and photon therapy, proton beam therapy?
As we know, in case of these two radiotherapy modalities, we have to talk about an exit dose, which can we find in case of photon radiotherapy. So after passing the tumor, these beams we can measure in case of photon radiotherapy an exit dose. And in the other hand, in case of proton radiotherapy, there is no exit dose, so the beams are concentrated on the tumor and destroys the tumor's probably efficacy, but there are still lack of data in this topic. Thank you.
My question would be that are the treatment indications for proton and photon therapy the same?
Thank you. No, they are not the same. And first of all, because proton radiotherapy is available just in a few centers all over the world, so it is a bit hard to find these radiotherapy modalities all over. So this is the first one. The second one, the cost effectiveness of two radiotherapies are also different, but as and these are the main two problems why these are while it's not the same the indication for both for the two radiotherapy modalities. And there is a lot of discussion because the proton radiotherapy is the newest one, and there are not so many data about this radiotherapy modality, so it's not defined very well which are the indications for photon and for proton.
Thank you for your interesting presentation. I'd like to ask that how could you measure the severity of the side effects, and what do you think, how long it is worth to follow the patients up?
Sorry, I can't hear the second part of the questions.
What do you think, how long it is worth to follow the patients for the side effects?
In the first part of the question, there is a CTCA, as I projected in the slides. There is a scale, the CTCA scale, that is used worldwide, and I can find it also in the articles, and we can measure the side effects by this scale. There are very well defined all the side effects and the grades of these side effects. And as the follow-up, so this, I think that you are referring for my next second topic as in follow-up. So there, the registry is running from 35 years, so there we can find a longer follow-up period, and in this case, we would like to establish times when we would like to measure these side effects. So it can be somehow grouped that in first year, in third year, and in 5 year, what side effects can we find.
Congratulations on your presentation. And you mentioned that you'd like to check for neurocognitive difficulties and declines. Can you tell me which one is the most frequent, or which do you have the most data about?
In this case, most of the papers are mentioning the IQ as the most frequent, but we can find also verbal reasoning or perceptual memory, but the most used is the IQ.